Gentlemen, we've got a question that comes to us from Duluth, I believe it is. The point being made that Minnesota, along with other states, undergoing a tremendous problem in opioid drug addiction. And so the question comes, what is the state doing, or can we be doing this year, if anything, to curtail the flow of drugs into the state or deal with the demand and treatment? So, broad topic, heavy topic, many media articles and television, radio items about this very topic. Where do we go? What can we do?
Well, one quick comment. When the reference is to the flow of those drugs into the state, the big problem is prescriptions and doctor shopping and so on with the opiate drugs. Mm-hmm. I think something needs to be done within the medical community, and I'm not sure exactly what at this point, but where the doctors start to monitor that more closely, the pharmacists monitor it more closely. We keep hearing where people will go pharmacy shopping, they'll go doctor shopping to get those drugs, and many people apparently are getting caught up in those drugs rather innocently because they're prescribed and they're very potent, and if the doctor prescribes too many pills, I'll put it that way, you can get addicted very quickly.
Well, they're painkillers.
Yeah.
But we have...
When you've had surgery or something,
right.
And if they give you too many days' supply, you're addicted, and then from there you try to get more. And
once again, in one of our House Republican caucus discussions this week, we did talk about the opioid problem, and we had two members who presented to us, and there are a couple of bills on the issue that I think are being fine-tuned as we go along.
And it's not just a metropolitan problem. I think rural Minnesota has been hit heavily in some neighborhoods.
Mm-hmm. What we did in the Senate is we passed a bill out of the Senate just this last week that allowed the pharmacists to get more involved in taking back these drugs. And we feel that could help a lot to get a lot of them off the street, too. And that's another issue, not only like Representative Carlson said, but there's also an issue with getting those drugs that aren't being used back off the street and not being sold or moved illegally. So we felt that would be a good step forward.
It was. But it's a huge issue, and it has to be resolved one way or another. And in part, I'm saying the medical community has got to be more sensitive.
And part of that, too, is, you're starting to share the medical information. Your data privacy piece argument comes up again, saying if I'm Dr. X and Dr. Y, if I choose right now, you fill out that HIPAA form every time you go to a doctor's office, and you can put in there, do not share this information. You still have that. So now you're starting to tap into a little discussion that might include some federal discussions and saying, okay, but we know the public piece is there, and that's why we did pass that bill, was to get folks within the pharmaceutical community, you know what, get these drugs turned in. Let's stop them before they get in.
Lots of moving parts to a societal problem in which the legislature will play a role at some point, dealing with either the violations of law and the sentences that go with it, or on the treatment side, or discovery of what's going on.